There's another controversial aspect to Wisconsin's COVID-19 vaccination plans. The subcommittee deciding who gets the vaccine and in what order has recommended that the state's prison inmates get vaccinated ahead of the general population. So we're talking about the COVID situation in Wisconsin's prisons with Corrections Secretary Kevin Carr. And Secretary Carr, thank you so much for being on the show. And this last week, there was some pretty big news concerning what you do. A state committee approved putting inmates in the list of people who will get the COVID-19 vaccine next in that group 1B. Now, this still has to be approved. It's not finalized yet or anything, but I'm wondering, do you agree with that? Do you think inmates should be in the 1B group?
Adrienne, thank you for having me on today. And yes, I do agree with that subcommittee recommendation for a couple of reasons. Every one of our 37 facilities are a vital part of the communities in which they're located. And our health services staff, corrections staff live in these communities. And I agree with the recommendation made by the subcommittee to include institution staff and the persons in our care in phase 1B, based on the arguments that those groups belong in that tier due to the congregate nature of the facilities that our folks reside in, the difficulty that they have in practicing social distancing, and that these individuals are in state care and deserve adequate medical treatment.
And I'm sure you understand that there could be a little bit of pushback on that when people realize inmates might be getting the vaccine before the rest of the population, people 65 and older and people with underlying conditions. What would your response be to that?
Well, first of all, protecting our staff and the persons in our care also protects the communities where our facilities are located. The public comment period is going to end on Monday, and we're prepared to move forward with administering those vaccinations should the larger committee approve the vaccination of the persons in our care.
And Secretary, I wanted to get to one more question. So in November, Scott Fitzgerald, at the time, he was the state Senate majority leader. Now he's a congressman. He said he was concerned about how the administration was handling the coronavirus outbreak within the prison system. He said that you and the governor didn't seem to have a handle on it. And according to the state, we know that just more than half of inmates in Wisconsin have tested positive for COVID-19. 25 people have died. That's as of Friday. How do you think you've handled this?
Well, I think, first of all, that the staff and the folks throughout the Department of Corrections have done a tremendous job under the most trying circumstances imaginable. If you think about it, back in November when Congressman Fitzgerald was on your show and made those comments, the entire state was experiencing extremely high rates of positive tests and hospitalizations all around the state. What I have learned during this pandemic is that as goes the community spread surrounding our institutions, so goes our institutions. Those things go hand in hand. Back in November, on November 23rd, we had approximately 2,300 persons in our care who tested positive for COVID-19. As of yesterday, we had 104.
All right. Well, Secretary Carr, when you do get that vaccine, of course, we're wishing you the best of luck in rolling it out. We know it's a big effort. Thank you.
You're welcome.
Next, former government workers criminally charged for a water crisis.